In an active medical practice, revenue rarely disappears all at once. It vanishes in tiny increments before a single claim is even generated. An eligibility check that gets skipped because the phone is ringing. A patient registration error that goes unnoticed. A copay that walks out the door uncollected. By the time your billing team actually sees the account, the money is already gone. This bar chart visualizes data from Experian Health's 2025 State of Claims Report. It shows a steady, alarming climb. In 2022, 30% of providers faced claim denial rates of 10% or higher. Today, that number has reached 41%. For practices relying heavily on Medicare Advantage plans, the pain is even sharper. Denials from those specific plans rose 4.8% in a single year from 2023 to 2024. When practice owners see these mounting denials, the immediate reaction is to look directly at the billing department. They audit the coders. They question the AR follow-up. But treating these rising denials as a downstream billing failure completely misses the actual source of the leak. Claims go out wrong, and payers deny them because the process actually failed 3 steps earlier. To find the actual mathematical driver of these lost dollars, we have to look upstream. We have to look at the pre-service patient intake process. This pie chart illustrates the root cause of the crisis. When surveyed, 50% of healthcare revenue cycle leaders identified missing or inaccurate claim data collected at intake as the primary factor driving their rising denial rates. This line graph tracks what happens to patient responsibility balances after the appointment ends. In the first 90 days, a practice has a 90% chance of collecting an outstanding balance. After exactly 90 days, that probability drops to 50%. At 180 days, it hits 20%. Past 1 year, the likelihood of collection mathematically approaches 0. On average, providers send 3.3 billing statements before receiving a payment. Each statement costs your practice time, postage, and staff hours, and mostly it involves chasing money that should have been collected before the patient was ever seen. Ignoring pre-service patient collections guarantees that a predictable percentage of your earned practice revenue will inevitably age into uncollectible bad debt. This timeline visualizes a structural flaw present in most medical practices, the mid-cycle gap. Your front desk handles scheduling and check-in. Your billing team handles claims and accounts receivable. Pre-service collections lives in the unassigned void exactly between those two functions. The sheer volume of tasks required to bridge this void is staggering. A practice seeing 80 to 100 patients a week must perform 80 to 100 individual insurance verifications, check every deductible, and flag coverage gaps, ideally 48 to 72 hours before the patient arrives. This scale weighs the prohibitive cost of trying to handle this internally. Hiring an in-house coordinator costs between $55,000 and $75,000 annually. Compounding that expense, the MGMA reports an annual turnover rate for medical billing and coding staff of 32%. Staffingly offers a precise alternative. They provide an outsourced team of AAPC and AHIMA-credentialed specialists entirely dedicated to pre-service collections, starting at just $399 per week per seat. The math is clear. Right now, most practice owners are paying up to 4 times more to try and staff this internally, absorbing constant turnover risk and still failing to stop the revenue leaks. The reason Staffingly's model works so efficiently is how they interact with your existing technology. Their credentialed specialists work natively inside your current EMR, whether that is Epic, Athena, eClinicalWorks, NextGen, or Advanced MD. This removes all operational friction. There is no screen share lag. There are no clunky third-party portals to navigate. It is a direct, secure connection. With direct access, the proactive workflow begins. The team verifies insurance eligibility 48 to 72 hours in advance, confirming copays and out-of-pocket responsibilities, documenting everything in real time before the patient ever walks into your waiting room. This workflow is heavily augmented by an AI layer. The system uses smart routing to automatically flag high-risk accounts, complex coordination of benefits, and lapsed coverage, prioritizing them for the specialists so they are resolved instantly. By inserting specialized, dedicated labor directly into your EMR, the mid-cycle gap is completely sealed. The right data is captured before a claim is ever generated. We can measure the exact impact of this proactive workflow by looking at over 800 medical practices currently utilizing Staffingly across the country. This calendar shows the acceleration in cash flow. The industry benchmark for days in accounts receivable sits at 40 to 50 days. Practices that outsource their pre-service collections to Staffingly see their AR days drop dramatically, moving from 45 days down to a healthy 12 days. Because the upstream data is accurate, those practices also experience an 80% reduction in overall claim denials. Contrast this reality with the chaos of an overwhelmed front desk trying to verify insurance while the phones ring. The paper chasing stops and cash flow becomes highly predictable. When you permanently fix the data at intake, the downstream denial crisis resolves itself. Deploying this solution requires very little downtime. Staffingly handles the EMR connection and secure access setup within 48 hours, and most practices are fully live and operational within 14 days. The entire underlying compliance infrastructure is completely ironclad. Staffingly maintains HIPAA, SOC 2 Type 2, ISO 27001, and HITRS certifications, with all teams operating out of biometric secure facilities, featuring strict clean desk policies. Every launch includes a 14-day risk-free pilot scope. You make no long-term commitment until seeing real results and measurable ROI inside your practice. Stop watching your revenue evaporate before the billing cycle even starts. Book a demo with Staffingly today, bridge your mid-cycle gap, and reclaim your cash flow.